Hi, I'm Katie from Peck Nutrition. I'm a registered dietitian, and for the last 10 years, I've been busy away working in private practice, helping lots of people. I've done over 5,500 consultations, so learnt loads. And someone said to me, "We should do some videos," and I thought, well, why not? Naturally, I probably prefer being in front of clients, if I'm being honest. I am more of an introvert, but here goes. And someone said the first video is going to be crap, so don't worry. So hope it's not crap though. I thought I would just start with explaining how I could help you if you were thinking about coming along to see me. What would I do with you? So first of all, I start with the types of clients that I work with that I like to help. And I suppose you could say it's people who feel like they need to get their health back on track. And it could be someone that has gone through a major health issue, maybe had surgery and has gained some weight, or has a digestive health issue, needs to get their health back on track. Or it could be somebody that's been diagnosed with blood glucose levels that are a bit high and worried about getting diabetes. Or it could be someone with diabetes. It could be someone who's gained some weight and has high cholesterol and high blood pressure and they want to reduce that. I help treat digestive issues, so a lot of people come to me and they've been to see their doctor or gastroenterologist, and they have been told there's no clinical cause for their symptoms. They have various functional symptoms, and that's my job to treat those symptoms through lifestyle, diet, and any supplementation. So that is how I help clients with digestive health issues. The other side of things is I see people really who want to lose weight. So when we talk about weight loss, we're talking about reducing the levels of body fat. And I help mostly people who feel like they're confused about food and how to eat right. And they may have gone on lots of diets and feel that they have yo-yoed, so they've lost weight and then regained it when they've come off the diet. So I suppose I help people to get rid of that diet way of thinking. Yes, so we address all these things with really starting with the mind, because good health starts in the mind, but it's really getting people back connected with, I guess, the foundation habits of self-care. So that's with hydration, eating habits, and appetite control, understanding foods they should be eating, portions, and any supplements. So I suppose in my work, it's not a cookie cutter approach. I treat each individual as the individual that they are, and I think people can feel quite confused about really how to eat, how to interpret the healthy eating guidelines into a practical sense of what I'm doing every day and feeling confident about it. There's so much information available on the internet and media and, Joe blogs and, the mother-in-law and everything. So people feel confused. So I help to eliminate the confusion and move people quickly forward to their goal from A to B quickly. And it's a non-dieting approach. So it's understanding about you, what your needs are, and how to reach your goals quickly. So those are the types of people that I help. How I do it, I've kind of said a little bit about that. The other thing is that I started working with a weight loss surgeon. So once a week I go to the Benetton Hospital and I do, I'm the bariatric dietitian there. So that's helping people that have had a gastric sleeve. A gastric sleeve is where 80% of the stomach size is removed. A gastric band and also gastric balloon. So those are people that have literally tried through dieting over the years, and they have a lot of health issues associated, or they may have some health issues associated with obesity or high body fat levels. So that's the work that I do as well. So in terms of how I help my clients, this is not the weight loss surgery side, it's the other side is each new client comes for an assessment and a treatment plan. What that means is I give all new inquiries, all new clients assessment forms to fill in. So clients complete those, they send them back to me, I will review them, then I meet the client for an hour and a half, and in that hour and a half we complete the assessment and we pinpoint exactly what it is we want to achieve, what the frustrations are, and what is linked to those frustrations, the cause, and therefore what we have to do to solve the problem. So again, as I said, we're looking at foundation self-care principles with nutrition and healthy living, and we're also just getting back to the grassroots, and this is what you have to do. People forget about the basics. The basics are incredibly important, but most people are not actually understanding what those basics are that can achieve the results. So they're looking for some kind of magic wand or superfood, and it doesn't really work like that. So I finish the plan, we kind of do the plan in that 1 hour and a half consultation, then I will send the plan to the client, and that's really everything that they need to move them quite significantly forward. And the client, then you can decide how you want to put that plan into practice. That is planning out what you're going to do every day. So in terms of follow-up after the assessment and treatment plan, there's various two options that you can take. You can either, like I said, take it and just do it yourself and come for ad hoc follow-up. So that may be a 50-minute session once a month, twice a month. The other service I provide is a 30-day plan, and that is for people who feel like they need day-to-day support to put the treatment plan into practice. And I love working with clients with this, because what I do is I understand about their schedule and plan out everything they'll be eating in a week. We meet once a week over 4 weeks, and in that meeting we discuss the plan for the week ahead, so they know when they have to eat and drink and how much, and it's really fits in with their life. So I suppose it's like I show them how to eat right for their bodies every day, which is like what I do naturally for me in my life. So what to eat before exercise as well, what to do if you're eating out. So that's a 30-day plan, and we share a document and we update it throughout the day so I can see how they're going. So yes, that's how I work with clients. And hopefully you find that interesting. If you would like to talk to me, please give me a call. If you go to the website, that's www.pecknutrition.com. Feel free to sign up. There's a free menu plan you can download, and you can join the email list. We have 1,150 members at the time of this recording, which is really lovely. I enjoy sending emails, which I do every week to my list. But feel free to give me a call and we can schedule a time to speak about coming to work with me, and I can explain to you how I would help you, and you can see whether I'm the right person for you. Hopefully I am. and yes, so great. So that wasn't that bad, was it, recording the first video? So hope you found that interesting, and please do get in touch if there's anything else I can help you with.